Okay, guys, if you can't find the kneecap, I'm going to give you an F.
Where is it?
Exactly. Exactly. Patella. There we go. Can't miss it. Now we have the superior part and we've got the inferior part. We've got the medial. We've got the lateral. It all sets up from anatomic position, okay? So, next one.
Tibial tubercle.
Tibial tubercle, tibial tuberosity, we talked about earlier. It's the attachment point for the patellar tendon.
So the anterior aspect of quadriceps.
Anterior aspects of the quadricep. The beautiful part about this, guys, we talked about this last class period. We showed you the resistive range of motion. So today we're just going to quickly palpate them, all right? So just going over them one more time. We've got the rectus femoris. We've got the vastus medialis oblique, vastus lateralis. Beneath the rectus femoris, we have the vastus intermedius. We can't palpate the articularis genu. Go ahead.
Infrapatellar tendon and suprapatellar tendon.
Okay, we said it earlier. Infrapatellar tendon. Patellar tendon comes down from the quads, attaches to the tibial tuberosity. Here's the superior part, so we call that the suprapatellar tendon. Here's the part below the patella, so we call that the infra, for below, inferior. Infrapatellar tendon.
Superficial infrapatellar bursa.
Superficial infrapatellar bursa. That's a lot of words. So if we dissect it, superficial, so closest to the surface, infra, so below the patella, bursa. So right in here, very common one for the athletes to have swollen. Right through here, we have a little bursa underneath the skin that, when swollen, pops up really big. That's the location.
Prepatellar bursa.
Prepatellar bursa. Pre would mean before. We didn't say supra, so it's not above. We didn't say infra, so pre. What do you think, Alex?
Under.
Not really above. How about in front of? Okay? So that one is on the top of. That's a word we haven't really played with much yet. So say it again for us.
Prepatellar bursa.
Prepatellar. So before you get to the patella on palpation, you actually palpate the prepatellar bursa. It's right here on top of the surface of the patella.
Pes anserine bursa.
Pes anserine. Now, if you remember right, we talked about the three muscles of the pes anserine group that come, the sartorius, they all come over here. Right about here, you have a real funky little tubercle that pokes out underneath the tibia. That is also the location of the tendon that attaches for all pes anserine groups, and that's where the bursa is, right here.
Medial meniscus.
Medial meniscus. Bend the knee. Find the joint line by having it flex and extend. Excellent. Medial meniscus here. Lateral meniscus here.
MCL.
MCL. Best way to find the MCL is have him seated. Find the condyles. Find the joint line. Have it flex up and down. Flex, extend. Keep going. And go back and forth on the joint line until you feel kind of almost like a guitar string. And that's also the best way to find it on the lateral side. Find the joint line. Go lateral. Go back and forth perpendicular to the joint. You'll find the LCL.
Sartorius, gracilis, and semitendinosus.
Pes anserine group. Up. Sartorius. Gracilis comes down. Semi-10. Right there. All come and attach to the pes anserine area. Let's go ahead and pause.